Welcome back for another exciting episode of Maverick Beat. I'm your host, Rena Greifinger, Managing Director of Maverick Collective. Maverick Beat is a window into the lives of the women and girls that Maverick projects serve, through the stories of those who are delivering the projects and the Maverick women whose partnership makes them possible. On this episode of Maverick Beat, we get digital. First, indulge me in a little game. Close your eyes and give me a smile if you recently exchanged messages with someone on your phone. Keep smiling if you've booked an appointment online, chatted with a health provider through an app or online portal, used your phone to access health data. I can't see you, but my guess is that you are smiling pretty wide right now, which really makes my day, and hopefully yours too. The digital age is upon us, and while there are still a lot of unknowns as technology evolves, there's so much we can be grateful for and celebrate. Technology brings us unparalleled connection to people and information, convenience of services, and rapid innovation across all spheres of our lives. It has become the backbone of modern life, and as we will talk about today, a critical element in improving and saving lives around the world. Through our digital innovation work, PSI is using phones, apps, and other digital systems to gather consumer insights, provide tailored information based on consumers' needs, link consumers to quality care, track healthcare uptake, get feedback on services, and create a continuum of care so that Sarah has many ongoing touch points with the health system and doesn't get lost. Now let's head to Zimbabwe, a southern African country with some of the highest rates of HIV/AIDS in the world. Promisingly, the majority of those people, about 86%, have access to antiretroviral treatment. Antiretroviral treatment, often called ART or ARV, is a game changer, allowing people with HIV to live pretty normal lives. Of course, it comes with enormous challenges. People living with HIV have to take ARVs every day without fail. They have to have consistent access to healthcare providers to keep the disease in check. And keeping tabs on their health data is essential. Yet too often, people are unable to stick to their daily pill routine or stop accessing the healthcare system for all kinds of reasons, including far distances to clinics, poor infrastructure, and deeply held social stigma about HIV/AIDS that keeps people living in secrecy. With the invaluable support of Maverick Collective member English Sol, PSI Zimbabwe set out to change all that. In this segment, we will hear from English, PSI Zimbabwe's Senior Information Systems Manager Alec Diliwayo, and Raymond Yakaye, Head of Programs for the National AIDS Council in Zimbabwe. They will discuss a transformational pilot project in the Makoni District that set up an electronic medical record system, linking 7 healthcare facilities with community-based healthcare workers, all using handheld digital devices. The project has revolutionized the way we capture, document, and share health data, moving away from a paper-based system where mishandling and loss were common to a digitized system that is more accurate, quicker, and embeds privacy. What might be most powerful about the technology built through this project is that it can be scaled quickly and applied to any service that community health workers are providing, such as for COVID-19. Let's tune in.
My name is Raymond Yakaye. I'm the head of programs for the National AIDS Council. And basically, I'm the focal point for the project in Makoni with Maverick. And I'm the point person in all our interactions with PSI Zimbabwe.
Hi, I'm Alec Diliwayo. I am the Senior Information Systems Manager for PSI based in Harare. I've been responsible for the implementation of the EMR in Makoni for the Maverick project.
Hi, I'm English Sol, and I am a Maverick Collective member who was able to join in on this project. I think one of the things that really stood out about this project to me that was really exciting and made me want to invest in it was that it was a really wonderful nexus between enabling digital health systems and enabling community health systems.
The Zimbabwe is a fairly large treatment program. We have about 1.4 million people currently living with HIV, estimated according to our estimates. of which 1.2 million are now currently on ART. One of the issues that we have noted over the years has been issues to do with high defaulter rate and also high loss to follow-up for patients. And this is compounded by the distances to health facilities, as well as just the poor network, transport network within most of our districts. What we then did in terms of our national strategic plan for HIV was to prioritize differentiated service delivery as one of the key programs that we needed to implement. The project itself was meant to bring services closer to the people, ensure that people adhere to treatment, and that where possible, we improve data systems. And that's where EMR comes in, because we also noted that sometimes when we are saying that we have lost patients to follow-up or they have defaulted, in reality they had not defaulted, or maybe they'd just gone and picked up elsewhere their medication. So we needed a system that could help us real time to report on the status of our patients.
So in order to support these innovations, we implemented a EMR, which basically linked the facility to the community. This EMR was deployed at the facility, each of the 7 facilities. And as clients are initiated at the facility by the nurse, the catives or the healthcare workers are able to come through and download the clients onto mobile devices. We had to build server rooms from the ground up, installed power, basically mini power stations for these clinics. And then to just support the offline work, we had to come up with innovative ways of just sort of making sure these guys charge their batteries. So we came up with these solar-powered backpacks where they plug in their tablets. And they also they use that as well to put in the medications that they're going into the community for. So I think it was just a culmination of a lot of just digitization or digital transformation of an existing system that pretty much was largely paper-based before.
Totally, I couldn't agree more. And Raymond, I'm curious from your perspective. You see a wide array of these types of projects, and I'm wondering if you felt that there was anything kind of new or unique in what Alec is talking about, just around the digitization of, like, to me, that was just kind of one of the coolest things to watch and see evolve over time, and then also see the community health workers and the workforce just really take hold of it and lean into it, which was really cool. And I'm curious about your thoughts on that too, Raymond.
From where I sit, it's something that we have now been talking about. How do we bring technology to the communities to enhance health reporting? What I can actually say is that lessons learned from Makoni, we actually used it to build a case to the Global Fund. Yeah. And what has happened right now as National AIDS Council, we have received around 5,000 tablets from the Global Fund to give community volunteers to use. And this is basically borrowed from the lessons learned from Makoni.
I remember talking to one of the community health workers, and I believe her name was Fiona. I asked her, I was like, what's been the most exciting thing to you? And she was like, I've learned now this new skill of being able to engage with the technology. And like, no one can take that away from me. Like, I have this skill, and now I'm trained, and I'm, and it's mine. And it was just really, I think that was one of the coolest things to witness over time, was just the grip, that everyone sort of took on this project around the skill sets that came to bear, and just the passion and the excitement. And Alec, I'm curious, like, what did you observe, kind of, because I only got kind of intermittent moments with the just kind of longevity of the project, but Alec, you were up close and personal, and I know we talked about this before, but one of the coolest things from my perspective was also just like the grit that you had, and sort of like even just like the server room that you create, like that was just like so cool. And I was just so impressed at the just like the push that you and the team showed on just sort of saying, well, we just have to get it done. And like with the solar panels and just like all of these things to like just make it work. So I'm curious, Alec, too, what were some of the things along that timeline that you saw in those milestones with sort of the team and the community health workforce that were like, did anything surprise you in that?
Yeah, so I was just going to say, so before the EMR and the innovation, we had silos of information. So when you come up with an innovation approach like this, you mentioned before that there was duplication. You did not know if this was the same client who went to a different facility. But with an EMR, we're able to then register this client and then offer all these other services, hypertensive checks, and include this into a longitudinal file or record, what we're calling the electronic health record, that can be tracked across different facilities. So I think elimination of these silos across health areas was one thing we managed to do, and was a challenge before, but the electronic medical record system was able to address. I think another challenge that exists as well was just in terms of the speed and accuracy of data. Previously, we had paper-based systems, and this was being jotted down in a paper-based notebook, which could get lost and sometimes was illegible. But what we've managed to do is we've managed to improve the quality of the data by having an online form, and also not just improve the quality, but also just the speed at which it's transmitted centrally to a clinic for clinical decision support for this client. So, and I think one of the other challenges, I think, is just how do you ensure healthcare worker efficiency? And how do you support that? And I think that's how this innovation has also helped in terms of just helping the cadres just be more confident and be able to undertake their work with a standardized set of tools that helps them just to do their job better.
English, in your 2 visits to Zimbabwe, no one ever thought we would be talking about COVID. And even when we were starting to see the demand for additional health information and health products and services from the community cadres, well, it never struck us that we would have to deal with COVID. And then all of a sudden, and it was pretty quick. We had COVID, and when it was spreading, well, it was in China and all over the place, and no one really thought something is going to happen. And we were one of the late countries in terms of declaring a lockdown. But then later on, you realize that the lockdown means no one can even go to a health facility. You need special letters and so on. And so what we then said, no, these community cadres we have to use them, not only for their own good, but also for the community's sake. So they became, from the information that we gave them to protect themselves, they became a source of information on COVID to the community. So we said we need to expand their role to also cover COVID. So being able to quickly adapt and implement and see change and see results, I think it's one of those things that I will always cherish in terms of working on this project.
Another thing, Raymond, that also just I cherish about this project is how our learnings, you mentioned so many of our learnings, but from a technical point of view, so much of what we've implemented in terms of the EMR has gone back into the community. Truly, this project is a trailblazer in terms of being a global good. We've had so much interest from just all over the world over this Bamni EMR implementation in terms of the community module. And I think that's something I'll also cherish in terms of the contribution to the broader free open source software community that this project has added.
This project in so many ways is where and how I was able to sort of grow up as a philanthropist in the space of global development. And it was because this team was so collaborative, and I got to sit in the team structure in such a way that I've never gotten to really do in other contexts, and put a researcher's hat on, put a problem solving hat on, and it was just such an amazing learning environment. I think that everyone on the team has just leaned into the project and sort of said, hey, let's just solve a problem together. It was just sort of like, let's adapt, let's problem solve, and let's do it in a way that is sustainable and scalable. And I think that we all really it was just such a wonderful environment to do that in. So I just wanted to express my gratitude and appreciation for that.
Alec put it perfectly. This project is a trailblazer in serving the world with a global good. The World Health Organization estimates that there are 1.3 million community health workers worldwide. That is 1.3 million people that could have this electronic health record technology literally in their back pocket, making all sorts of healthcare more accessible, equitable, high quality, and streamlined. Power in the hands of healthcare providers is power in the hands of consumers. English, we could not have asked for a better partner than you on this incredible piece of work. Your passion for data and systems, combined with the smarts, flexibility, and deep curiosity that you bring to our partnership, are simply unparalleled in the philanthropy world. Alec and Raymond, thank you so much for sharing this incredible story with us. Just as you cherish this project, we cherish your continued leadership and commitment to revolutionizing digital technology so that Sarah can thrive. That concludes the first part of this episode, Got Digital, redefining how we deliver healthcare. Thank you for tuning in to another great segment of the Maverick Beat, and please make sure to watch the amazing impact PSI and Maverick Collective are making in digital health globally in the next segment.